Aultman Hospital, Jackson Family Practice, and Dr. Stan Anderson, Canton Regency, and Ohio Head and Neck Surgeons. Now let's join the host of Canton's Morning News and the host of Health Week, Pam Cook.
And good morning, everyone, and welcome to our Wednesday broadcast of Health Week. We thank you very much for joining us this morning. And don't forget, we're live on Facebook right now, so you can watch us just by liking our Facebook page at 1480 WHBC. And if you missed the show today or missed any of our Health Week broadcasts earlier this week, you can always find them in the video section of our Facebook page. And today we have a two-part show for you. In our first hour, we're going to be talking with the folks from Aultman and AultCare, and in the 11 o'clock hour, Jackson Family Practice. And right now, we welcome in Trisha Witts with AultCare's PrimeTime Health Plan. Good morning, Trisha.
Good morning.
Good to see you. And so first, before we start talking about a PrimeTime Health Plan, I want you to tell our listeners a little bit about yourself.
Okay. As mentioned, I'm Trisha Witts, and I've been with the organization for 25 years, mostly with PrimeTime Health Plan. I started in customer service and now in the role of sales supervisor, and I feel like I just love our population, the interpersonal relationships that are gained with working with our people. And I just love the Medicare population, I should say.
Yeah, and it's a growing population.
It is.
And so it becomes more and more important. And look at Medicare. Talk about Medicare. What kinds of things it covers and what should we know?
Okay, and great. When it comes to Medicare, it is a federally funded health insurance program, and it started in 1965. It is available for those who are 65 or those that are considered to be disabled once they've been disabled for 24 months. The things that it covers, Part A, there's two separate parts. Part A covers inpatient hospitalization, skilled nursing, hospice, and home health care for some examples, as where Part B covers outpatient services, doctor visits, emergency room, radiation, chemotherapy. When it comes to both Parts A and B, there are some co-pays and co-insurances involved. For instance, if someone were to go into the hospital, days 1 through 60, they would be responsible for a $1,600 annual deductible. It's not annual, it's per benefit period every 60 days, but it's $1,600. And there's co-pays that follow that beyond 60 days. As where Part B, you have a $226 deductible for 2023, and once that's met, then Medicare comes in, starts to pick up claims at 80%, which leaves the patient 20% responsibility with no max out of pocket. And what that really means is there's no limit as to what they'll pay for their services with that 20%.
And then you have to have either supplemental or you have to have Medicare Advantage. Explain, how people choose those kinds of things, because that's where the confusing part comes in, I think.
Absolutely, it does. So while it's not required to have an enhancement option such as a supplemental plan or a Medicare Advantage plan, it could save some high out-of-pocket costs because, as I mentioned, there's no max out-of-pocket. So just to kind of go over the differences, and this is where I think Medicare Education is the most important, because as people are getting bombarded with a ton of information, they have trouble deciphering which is which. And really outside of Medicare, they're really only receiving 3 items. They're receiving supplemental plan information, prescription Part D information, and Medicare Advantage information. And when I explain it, I like to separate it out by option 1 and option 2. So under option 1, you have original Medicare, and then you would purchase a supplemental plan which would pay secondary to your Medicare. And when it comes to a supplemental plan, they're identified from letters A through N. And amongst carriers, they're all the same. So if you're looking at Plan G, let's say, Plan G is Plan G is Plan G. The difference is going to be the cost, as well as if they are offering things such as household discounts, as well as gym memberships, okay? And what's nice about a supplemental plan is you don't have so much out-of-pocket cost, but you have higher monthly premiums, so that's something to think about. And you can use any doctor that's Medicare accepting, unless it's considered a select plan. If it's a select plan, then that means there is a network to follow. So those are just some things to look at when it comes to the Medicare supplements. Now, it doesn't cover any it doesn't cover any dental, vision, hearing. It doesn't cover prescriptions. So under option 1, that's where the third entity comes in, where they would need to pick up a Part D plan. And there's about 28 different carriers just in this area. So that would be the second option that they're receiving in the mail that's piling up that they need to weed through, okay? And they range anywhere from $7 a month up to $80 and above. It's important to look at the formulary, which is the list of medications, making sure that that plan's going to cover those. If they have a provider network in the way of pharmacy, some of them have preferred pharmacies that would be cost savings to stay within, and mail-away systems. Do they like to mail away their medications? Who is the provider for that? So under option 1, you have Medicare Part A and B, a supplemental plan, and a prescription Part D. So option 2 is the one-stop shopping of Medicare Advantage, and that's the third item they're receiving in the mail, okay? If they're opening their books and they see that it has medical as well as prescriptions, extra benefits like dental, vision, hearing, that's going to be the clue. It's a Medicare Advantage. These plans work all together differently because they are subsidized by the federal government. For every member that the carrier has relating to an Advantage plan, they're receiving a subsidy. So Medicare's behind the scenes working. They're not actually going to lose their Medicare, but that carrier is going to be the only insurance that they have. So they're showing their card to all doctors, hospitals, and pharmacy. And they do include dental, vision, hearing, as mentioned. They have $0 premiums that they start out with, cost-sharing responsibilities, the copays that you don't really have with supplemental policies. So that might be a deciding factor for someone.
Yeah, should people base it on obviously what their current health situation is? If they, have some pre-illness, if they have cancer or have had cancer, or they're a diabetic, those kinds of things. They base their choices on that too.
Absolutely, and in the same household, husband versus wife, their needs are not the same. And there's different time frames as to when you can enroll into these plans, so it's always good to talk to someone about that just to see your situation for what it is, because there's guaranteed issue opportunity for supplemental plans, as where Medicare Advantage plans, that enrollment period is a little different. So I always encourage everyone to have that conversation.
What about things like home health aides, after you get out of the hospital, or if you have nursing home facilities, or, need help that way, what does Medicare cover with that, or Medicare Advantage plans?
Well, they both cover up to 100 days, and depending on the plan, you will have some copays involved there, okay? Anything beyond 100 days is not covered by Medicare, so it's not going to be covered under the Advantage plan either, because the Advantage plans are following Medicare guidelines.
And there's a lot of rules. There are a lot of rules. There's a lot of different options for people. How do they get help with all of this?
Well, there's plenty of brokers that are out in the community that are willing to sit down with people to have that conversation. Depending on the carrier, they can walk into the office and have that conversation if they have a certain interest. Maybe it's PrimeTime, they can come in. We're available Monday through Friday, 8 to 4:30, to have those discussions with people and their personal information, so we can kind of guide them.
The one thing that I hear from people with PrimeTime is that you guys are here. You're local. There's other places that, they're calling that are outside of this area. That would have to be something that's an advantage for you.
Absolutely. We strive to provide the best customer service possible. I feel like we have been recognized by U.S. News and World Report for the 7th time as one of the best Medicare Advantage plans. And that speaks to our 5-star rating as well, because we do have quality care and service for our members.
What do you see as the biggest concern when people come and talk to you about, trying to choose their plan?
I think mostly they're overwhelmed because they don't understand their options, and it's hard to make that decision. They see commercials, they're receiving phone calls, the mail is piling up. And I think for anyone, lack of knowledge makes it stressful. So even if you just come in to have a conversation to decipher which is which, I think it makes it a little easier.
And if they want to get in touch with you, how do they go about doing that?
So the advertisements are everywhere, radio, TV. they can visit our website, www.pthp.com. We are located at 2600 6th Street in the Morrow House on Aultman Hospital campus. They can come in and talk to one of us. They can call in, and that number is 330-363-7407 or 1-800-577-5084, and TTY would be 711.
And talk about, before we have to take our first break here, talk a little bit about the different plans that you offer, because you know, when people look at all of these choices, I know we've mentioned a lot of different things. Kind of hone in on the PrimeTime situation, and what are the things that you guys like to make sure that people are aware of.
So PrimeTime itself, we have Medicare supplement policies, and we also have Medicare Advantage policies, and we have 4 of those. So with the Medicare supplements, we have plans A through N to choose from. The most utilized, I would say, would be Plan G if someone's looking to compare. And then, like I said, we have 4 Medicare Advantage plans. 2 of them are $0 premiums, and then they go up a little bit. And we could always explain the differences.
How often can you change your plan? You know, if you sign up for something and then you're going, oh, I'm not really sure this is going to fit.
Mm-hmm. So supplemental plans, they can change at any time, basically. It just is a matter of what period of life they're in, guaranteed issue. They may have to go through some underwriting. When it comes to the prescription drug aspect of it, typically they can make changes October 15th through December 7th for January 1st. And the Advantage plans tend to run in the same time frame, except for if they're a 5-star rated plan like PrimeTime, then we have open enrollment through November 30th.
Okay. Mm-hmm. All right. Well, that's a lot of information to take in, so it would be a good idea for folks to give you guys a call.
Yes.
And to sit down and talk.
Yes, absolutely.
All right. Trish, thank you so much for coming by today. We appreciate it.
Thank you for having me.
All right. We're going to take our first break, and when we come back, we're going to talk about Aultman Primary Care with Dr. Cliff Johnson, and also Amy Budd, who is the Vice President of Primary Care Operations at Aultman. And it is Health Week here on News Talk 1480 WHBC.
How would you like to do what you love while someone else foots the bill? Yes, you heard that right. Here at the Ohio Means Job Centers in the Stark and Tuscarawas counties, we will cover the cost for you to go through training. We can fund programs such as LPN training, CDL, welding, CNC machining, and more. Join us for our orientation sessions, advantage opportunity. To learn more or to see the upcoming schedule, you can visit our website at omjwork.com/training.
During Sleep Outfitters' free-for-all sale, you'll find huge deals on the top mattress brands, plus incredible free offers, like a free MasterCard or free bedding accessories valued up to $300, yours with any Tempur-Pedic, Stearns & Foster, or Sealy mattress. Plus, get interest-free financing for up to 5 years on approved credit or no credit-needed payment options, plus free delivery and setup with qualifying purchases. So don't miss the free-for-all sale, now at Sleep Outfitters. Find your store at sleepoutfitters.com.
Hi, this is Jim Snyder of the Your Wealth, Your Retirement program, a financial education show for those seeking guidance. Are you retiring soon? Are you in the middle of changing jobs? Maybe you're just done with all of that risk in the 401k plan, and you'd like to have a discussion about an early rollout. Maybe you're 70 and a half and you're in your income phase of your IRA. We can help you with all those. Give us a call at Senior Financial Group at 800-639-0824. That's 800-639-0824.
Heart failure, carpal tunnel syndrome, shortness of breath, stomach issues, lower back pain. How does it all add up? If you have heart failure and any of those seemingly unrelated symptoms sound familiar, it's time to talk with your cardiologist and get the full picture. They may add up to transthyretin amyloid cardiomyopathy. ATTR-CM is a rare and underdiagnosed disease. Recognize the signs and discuss them with your doctor soon. Learn more at connectwithyourheart.com. That's connectwithyourheart.com. Sponsored by Pfizer.
There are more identity threats than you realize. Even if you monitor your credit, only a little personal info needs to leak out, like your social security number or password,
for you to become a victim.
LifeLock alerts you to threats you could miss. If your identity is stolen, a dedicated U.S.-based restoration specialist will work to fix it. No one can prevent all identity theft or monitor all transactions, but everyone can save up to 25% off their first year with promo code NEWS. Go to LifeLock.com.
Adopt US Kids presents What to Expect When You're Expecting a Teenager. Learning the lingo.
GOAT, G-O-A-T, acronym, stands for greatest of all time. As in, spaghetti sandwiches for dinner? They're my fave. Dad, you're the GOAT.
You don't have to speak teen to be a perfect parent. Thousands of teens in foster care will love you just the same. Visit adoptuskids.org. Brought to you by the U.S. Department of Health and Human Services, Adopt U.S. Kids, and the Ad Council.
Chase loves soccer.
I'm Chase Guerrero, and I'm 12 years old.
And his dream is to turn pro. That's why Chase and his family make sure he's always having fun and squeezing out his best with Go-Go Squeeze. Okay, buddy, let's break for a Go-Go Squeeze. Go-Go Squeeze fruit-on-the-go pouches are a nutritious snack made from 100% fruit with no sugar added.
That's my boy!
Because when you nurture your kids, you squeeze out the best in them. Squeeze out the best with Go-Go Squeeze. Not a low-calorie food. Products range from 11 to 13 grams of sugar and 60 to 70 calories per serving.
For the ones who know safety isn't a catchphrase, it's a culture. And the ones who help make sure everyone makes it home safe. For the safety-minded who watch everyone's backs, Grainger offers supplies and solutions for every industry, as well as safety assessments and training to keep your facilities safe and your people safer. Call, click Grainger.com, or just stop by. Grainger, for the ones who get it done.
You know, I grew up hearing that women are bad with money, but like many of you, I spent years paying bills, managing checking accounts, and taking care of my family. So, turns out women are pretty good with money after all. And now, I'm taking control of my financial future by saving for retirement. It's never too late to start, and there's a great website to help you. Check out WeSaySaveIt.org and jumpstart your retirement savings on your budget and your timeline. That's WeSaySaveIt.org. Brought to you by AARP and the Ad Council.
At SimpliSafe, we design award-winning security to protect every inch of your home. It's easy to set up yourself, and now there's an even easier option. Have an expert do it for you with SimpliSafe Pro Install. Always protecting, never a contract. 2 easy installation options. Backed by 24/7 professional monitoring for less than $1 a day. Get 20% off any new system with Fast Protect monitoring at simplysafe.com/radio. There's no safe like SimpliSafe.
Gilbert worked in retail and restaurant management for 14 years. It was time for a change.
I recognized where I was at was vulnerable to the whims of the economy.
Then he heard about My Computer Career. Gilbert went for it.
In as little as 7 months, I got all of my certifications at a fraction of a cost for college.
He became an IT pro in just months with zero experience at mycomputercareer.edu.
I can work from anywhere. I have more time for my family as well.
It's not rocket science. It's mycomputercareer.edu.
This is one student's experience. Individual results vary.
Welcome back on this Wednesday morning to Health Week on News Talk 1480 WHBC. Thank you for joining us this morning. And again, don't forget, we're live on Facebook right now. You can join us by liking our Facebook page at 1480 WHBC, and all of these videos from Health Week will live in the video section of Facebook. Now, we're going to turn our attention to Aultman Primary Care right now, and we have with us Dr. Cliff Johnson, who is the medical director for Aultman Medical Group Primary Care, and also Amy Budd, who is the vice president of Primary Care Operations. Good morning.
Good morning. Good morning.
And I'm going to have you guys lean into the microphone when we talk this morning. Dr. Johnson, we want to talk to you first a little bit about primary care, and maybe you can explain what primary care is, first of all, and how it's kind of changed over the years, because we know it certainly has.
So primary care is usually your first contact with the healthcare system. And usually the primary care physicians are the internist, the family practice doctors, pediatricians, sometimes a nurse practitioner or a physician assistant. But it's when you initially have a problem, that's who you go to. And we provide comprehensive and continuous care. So we get to know you over the years. We get to know your family, your spouse, your kids, your parents, and we really try to personalize your care. And nowadays, there's a really big emphasis on prevention and healthcare promotion. So a lot of the visits have to do with talking about trying to get people to eat healthier, exercise more, sleep better, the things that can try to keep them healthy. And there's a big emphasis now also on trying to detect diseases earlier. So if something is creeping up in you, we try to detect it early. by doing mammograms or by doing colonoscopies and trying to get polyps taken care of before they turn into colon cancer. And then if you do get sick and you get really sick and you need to see a subspecialist, we're the ones that try to coordinate your care. So, I have so many of my patients are in their 70s or 80s, they may be seeing a cardiologist and a kidney specialist and an endocrinologist and somebody else, and they don't communicate with each other, but they all communicate with me. So I'm able to try to put all the pieces of the puzzle together to make sure the picture is correct. So sometimes if someone's really sick like that, I feel like I'm the quarterback trying to keep the team running smoothly. And there's always an emphasis in primary care on trying to keep costs down, which is getting harder and harder in our healthcare system these days, but we really try to do that. And you ask, how does this change over the past 10 years? I think one way to think about it is how my day has changed in the past 10 years. 10 years ago, I was going to the hospital. I'd see sick people in the hospital. Some might be in the ICU. Somebody just came out of a big surgery. And I'd go to the office and take care of sick patients in the office. So my day was very exciting for me, but very bad for you if you happen to be one of my patients that day. Now it's the opposite. I don't go to the hospital anymore. I devote my full attention to my outpatient practice, trying to keep people out of the hospital, trying to keep them healthy. And a lot of my day is spent counseling patients on eating better, trying to stay healthy. So the perfect day for me now is everybody's doing well. It's boring for me, but it was really good for you if you were one of my patients that day.
Yeah, you're like the first line of defense. And, when somebody said to me, PCP, my PCP, I had never heard that term before. That's to me, is like a newfangled term, your PCP. It's always been my family doctor. But it has become the person everybody trusts and believes in, and that's, you always refer to your family physician as being the most important physician, like you said, that deals with all the other physicians that may be treating you at the time. So how is Aultman's Primary Care different than others in the community?
So I think there are certain things that are really unique about Aultman Hospital. First of all, it's locally owned and operated. So we have the physicians, we have the staff, we have the nurses, we have the administrators, we have the board members. They're all your family and friends from around here. They're not from out of town. Everybody has the same hope of trying to provide the best care for our patients at the lowest cost. Also, we're a big organization. We have over 120, physicians and nurse practitioners. We have 24 locations. We're over 4 counties. We see over 1,000 patients a day, yet we all have one EMR, electronic medical record. So we're all able to see what everybody else is thinking. You go to a stat care, you go to our cardiologist, you go, to the emergency room. We can all see what everybody else is thinking. I think that really helps coordinate care, provides the best care at the lowest cost for our patients. And then also very unique is that AultCare and PrimeTime is part of the Aultman family. And we meet with them regularly trying to provide the best care at the lowest cost for the AultCare and PrimeTime members.
So technology's okay with you then, right?
It's growing on me.
That's a good thing. That's a good thing. Amy, talk about how folks can find, the family care physicians here for Aultman.
So the easiest way for our community to access our primary care team is through our new patient hotline. It's old school, but it's a robust phone line that is answered 5 days a week. Community members can access our primary care providers by calling 330-433-1264. But if you want to have a digital access to us, we can be found on the www.aultman.org website, soon to be on the Aultman Anywhere app, and sometime in mid-July, if you are inquiring about establishing as a new patient, you can schedule yourself online on the Aultman Anywhere app yourself. But that's the way we have access to care today. Try to make it convenient both ways, digitally and traditional ways.
And so when someone makes that phone call or contacts you digitally, what kind of things do they, put in and say, well, I'm looking for this kind of a physician, or, what kind of things do you ask them about what they're looking for?
That's a good question. So we try to tailor the primary care provider to the patient preference. We ask location. Dr. Johnson had stated we had 24 locations over our 4 counties. So that's a big driver as to where we might direct a potential patient. Some patients are looking for male, some are looking for female. Some are looking for a provider that specializes in one particular area. So we try to direct it based off of those questions, based off of the preference of the patient.
I did it 30 years ago when I moved here for a 7-month-old baby that I had. And still the same doctor. So that's pretty good. That's
a good track record.
Yeah, it is. And I loved him. It was a perfect match. So how long does it usually take to establish, that relationship or that visit, that first visit, that kind of thing?
So that has been an area that we've really been trying to improve with Aultman Primary Care. It's that access to care. Primary care physicians they're tough to find, and that's why we hold on to the ones we have, like Dr. Johnson. But we now strive to provide 24 to 48-hour access to care for new patients, depending on the location and that particular provider's schedule. But generally, we can offer a 24-hour turnaround time.
And if someone's homebound or something like that, is there help for them as well?
Absolutely. We developed a new program service line within Aultman Primary Care called Aultman House Call. One of our primary care providers, if they have a patient that is unable to see them in the office, and telehealth is something that doesn't work well with that particular patient, they will send one of our advanced practice providers and do a visit in the home. So definitely going back a little old school, but it's well received and very well received with our elderly population, and particularly those patients that have just left the hospital and might not be able to access our bricks and mortar location easily.
All right. Well, a lot of great information and an easy way to find somebody to get started with and to feel comfortable with. So we appreciate both of you stopping by and sharing with us this morning. Thank you so much.
Thank you.
Thank you.
All right, we're going to take our break for the news right now, and we will be back. We're going to talk Aultman, Woodlawn, and Hospice coming up next on Health Week here on 1480 WHBC.
Are you worried about what might be in your family's drinking water? Give yourself peace of mind with a reverse osmosis drinking water system from Verndale Water Experts. Give your family safe, healthy drinking water. Call Verndale Water Experts today.
Verndale's Water Center.
WHBC AM 10, reliable as ever on News Talk 1480 WHBC.
From the News Talk 1480 WHBC newsroom, Ohio lawmakers are considering a new bill that could give local leaders more authority over the landfills in their communities. Senate Bill 119 would limit the amount of out-of-state garbage brought in to be buried in Ohio, would also redistribute funding from landfill fees to be used for local oversight. Senate Bill 119 is now in its final version. It could be added to the Senate's state budget by the end of this month. Inflation in the United States has fallen to its lowest level since March of 2021. The Bureau of Labor Statistics announced that yesterday. Consumer price growth dropped to 4% in May, slightly better than the 4.1% economists had predicted and significantly better than April's rate of 4.9%. Among the industries experiencing the least amount of growth in May were air travel and medical services, which fell from April's rate of 5.1% to 4.6%, according to the agency. A woman recently declared dead in a hospital in Ecuador turned out to be the opposite. The 76-year-old woman was alive and banging from the inside of her coffin at her own funeral. Her family members say they lifted up the coffin and her left hand was waving and hitting the coffin. They called 911 and took her back to the hospital. The woman was declared dead after not responding to resuscitation attempts after a stroke. According to the country's Ministry of Health, an investigation is now underway. Guardians lose to San Diego last night 6-3. We have a first-time Stanley Cup champion. The Las Vegas Golden Knights blew away the Florida Panthers 9-3. They take home Lord Stanley's Cup for the first time in their 6-year existence. For News Talk 1480 WHBC, I'm Pam Cook.
Your severe weather station, News Talk 1480 WHBC.
Here's your AccuWeather forecast. Clouds and sunshine this afternoon. High for the rest of the day, 70, then becoming mainly clear tonight with a low of 50. Tomorrow we'll have clouds and sunshine with a thunder shower in the afternoon. High on Thursday, 76. Then look for some sunshine Friday, although hazy skies can return with a high of 71. This weekend, mostly sunny Saturday and partly sunny on Sunday. I'm Holly Holdren for News Talk 1480 WHBC.
This Father's Day, visit Boot Barn for quality gifts and personalized services. Gifts range from durable suede jackets to premium exotic cowboy boots, iconic Western shirts, heavy-duty jeans, and work boots. We provide local same-day gift delivery with gift wrapping and a card included. Get $20 off your next order, and our team of experts can help guide you as you shop when you visit your local Boot Barn.
The 7-on-7 Kickoff Classic is brought to you by Kempthorne Mazda. Performance. It's what powers the 2023 family of Mazda CUVs with standard I-Active all-wheel drive and an available turbo engine, helping you take performance further. Find your Mazda CUV at Kempthorne Mazda and KempthorneMazda.com and join us on Saturday, July 5th for the 7-on-7 Kickoff Classic, presented by Kempthorne Mazda.
Welcome back, everyone, to our Wednesday edition of Health Week. And this segment, we're going to be talking about Aultman Woodlawn and hospice care. And we have with us Julia Provchy, and she is going to talk a little bit about the services and what exactly hospice is. This is a very good topic because so many people have so many misconceptions about hospice, wouldn't you say?
Yes, so many. And it's a stigma that we constantly have to try to overcome with a lot of patients and providers.
Right.
So importantly, hospice is really a philosophy of care that focuses on the care of the patient with an estimated life expectancy of 6 months or less with a terminal illness. We focus on treating the person rather than all the medical diagnoses, which is a big shift in focus in a lot of ways for our patients and their families. And we focus on quality of life for those patients. We surround the patients and the family, and we have a team consisting of a lot of different professionals, including doctors, pharmacists, therapists, chaplains, just to make sure we give them the best quality of life as possible. So we also are addressing spiritual concerns as well as physical suffering for patients and their families. It's also important to make sure that I emphasize what hospice is not and what we don't do. So there is that misconception that hospice hastens death. And what our goal really is to give patients the best quality of time for the time they have left, making sure that we minimize symptom burden and treat them so that they have symptoms that are treated like shortness of breath and pain to give them the best quality life that they have left.
So how do you assess a patient and determine that this is their time to move into hospice?
Mm-hmm. So the determination for a patient to enroll in hospice, since it is insurance driven, they have to have a life expectancy of 6 months or less. And this is a best educated guess. This can be done by the patient's primary care provider, like Dr. Johnson, or by the hospice physician themselves. And some of the indications that someone may be ready for hospice, may be getting into that 6 month or less window, is frequent hospitalization. So we see that patients are getting sicker and sicker and needing more help than they were before. Significant weight loss, so 10% or more in the last 3 to 6 months. A change in functional abilities, a change in mental status, so they're not as sharp as they were before.
increased weakness and fatigue, needing more and more help at home, an inability to complete normal tasks that they used to do. So they're not able to dress themselves or bathe themselves, which they were capable of doing before. If they have increasing pain, recurrent infections, or they just are ready to stop doing life-prolonging interventions like chemotherapy treatment, for example, and don't want to keep returning to the hospital. Hospice is a way of changing that focus.
So talk about approaching a family about hospice, because a patient may be ready, but a family may be not. Correct?
Yes, absolutely. So we often, on our first visit with patients and their families, and most of my role is in the hospital, is where we see people a lot for me, but we talk about those stigmas and we let people know. We know that these are out there. We know that you could be scared about talking about this, and really emphasizing what we do. And hopefully everybody can get on the same page with the patient and know how much support they can have. But I often acknowledge the fact that this is scary to talk about. We're talking about end of life and losing someone that we love very much.
Is this, you talked about insurance. Talk about how is hospice paid for? How does that all work with insurance?
Excellent. So hospice is not free, so somebody has to pay for it. Most people have insurance coverage, and Medicare is really our default model. So hospice is paid for by Medicare insurance, and most of our other insurance products kind of default to the same similar coverage as Medicare. In hospice, all of the medications that are related to the diagnosis admitting to hospice, so medications for pain, for shortness of breath, for nausea, for fever, for constipation, any of those things would be covered at 100% from your insurance, as well as hospital equipment. So a hospital bed, oxygen, you don't have to be qualified for insurance anymore. Those patients who don't have an insurance plan would have to pay out of pocket on a per diem rate. And in the home setting, that's somewhere around $200 per day. But if they have to be at a hospital level of care, requiring IV medication, for example, that wouldn't be safely done at home, that can be anywhere above $1,000 a day. Your other prescriptions, so if you had medications that weren't directly related to your diagnosis admitting you to hospice, then you could still have those medications, but you would just pay for them as you usually would through your insurance, maybe with a copay. It's important to note that the medications, the equipment, and things like that are paid for through the hospice insurance benefit for most insurance plans, and hospice traditionally has been done in the home setting. If home is not possible or safe because you don't have 24/7 care, for example, and you would need placed in a nursing home setting so that you could get that care, the room and board in that case is not paid for. So unless you have other insurance like Medicaid, or if you have VA benefits, then you would be paying out of pocket for the room and board piece, but all the other aspects would be covered by your Medicare insurance.
Okay. And so how does someone go about finding out if they qualify, how they get all of this set up? Is that something they just go directly to you guys for, or do they have to do it through a doctor, or how does that work?
Certainly. So I think we probably are most well-versed in who would qualify or not, and we, especially in the hospital, I have a nurse liaison who's amazing at explaining the insurance benefit. But if anybody ever has questions, they can ask for a referral from their doctor to a hospice agency. And although we would prefer, obviously, everyone to come to us because I think our team does such an amazing job, there are as many hospice agencies as there are Starbucks. So even if you're out of our service area or you know someone and you have a preference for another hospice, you could certainly ask for a referral to anyone. If you are interested in contacting us directly and you haven't gotten a referral, the phone number you can reach out to us, we have our Canton office, and our number is 330-479-2378. And then our Alliance office is 330-596-7480.
Compassionate Care Center. I want you to talk a little bit about that, too.
Yeah, so our Compassionate Care Center, we were lucky enough to have this created thanks to donations by our Aultman Women's Board. This has been probably 11 or so years ago, and it's the only freestanding hospice inpatient house in Stark County. Patients are welcome to go there, especially if we were talking about needing a hospital level of care. For example, they need IV medicine so they can control pain or shortness of breath that isn't managed safely at home. They're welcome to come to the Compassionate Care Center where our hospice nurses are, and they can manage pain, shortness of breath for as long as a patient needs to. Sometimes that means a patient staying there till end of life or until we can get them on a good regimen of medications for them to return to whatever level of care is safest for them.
And so you also would act as a good resource for people as well. Maybe they're not quite ready for it, but at least they could get the information and be prepared.
Yep, and I think that's one of the nice things too. So we're a hospice agency, but we also do palliative care. The biggest difference between the two is palliative care can be done alongside life-prolonging interventions. And in that case, our goal is to help you live better longer. And if you are interested in pursuing hospice at any point, you could always use palliative care as a bridge for when you are ready, but you could still have us as a support in the meantime.
All right, give those phone numbers again so if anyone wants to get in contact with you.
So again, our Canton office is 330-479-2378, and our Alliance office is 330-596-7480.
All right. We appreciate you coming by and giving us a lot of great information. Sometimes information people are afraid to ask about, for sure.
Well, thank you so much for having me.
Thanks, Julie. We appreciate it. All right, we are going to take another break, and when we come back, we're going to kind of wrap up our time with Aultman and AultCare and talk about the community, a community update. And Lisa Zellers, Vice President of Foundation Services, will join us. We know how involved that Aultman and AultCare are in the community. We've seen them firsthand with us at the radio station. And also, Eric Belden, Vice President of Fund Development, will join us as well. All of that and more right here on Health Week on News Talk 1480 WHBC.
School sports. This is the right place. News Talk 1480 WHBC.
Hey, the Roadman Kenny Rhoda here for Kempthorne Mazda. Everyone knows the Kempthorne family has been part of our community for 85 years, and now in their fourth generation, there's always a Kempthorne family member in their dealerships. And if you're looking for a new ride, you have to look at Mazda. How about the CX-9 with its nimble, instinctual driving dynamics? It defies what a three-row CUV can feel like. Find the Mazda CUV of your dreams at Kempthorne Mazda and see the full line of great Mazda cars and CUVs at KempthorneMazda.com. That's KempthorneMazda.com.
Hey, Stark County, when you think of spring cleaning, do you ever think of your medicine cabinet? You should. Prescriptions you do not need anymore do not belong in the toilet or trash, where they can pollute or even be misused by others, which can be dangerous. Instead, simply place them in one of the free drug drop boxes where they can be disposed of properly and safely, no questions asked. Visit starkmhar.org to find the box closest to you. That's starkmhar.org.
I'm Pam Cook for Ascent Audiology and Hearing Center. What you get at a big box store or online, not so good, because there is no one-size-fits-all when it comes to your hearing loss solutions. This is something that is important to you on a daily, weekly, monthly basis, just like getting your eyes checked or going to the dentist. You need to take care of your hearing. Ascent Audiology and Hearing Center, 2 great locations, one in North Canton, the other's in Hartville. Check out AscentOH.com.
Wesley Financial Group is not a law firm.
This story is called The Ugly Truth About Timeshare. If you think you've done your family a favor by buying a timeshare, you need my help. Hello, I'm Chuck McDowell, CEO and founder of Wesley Financial Group. 10 years ago, I started helping folks cancel their timeshare. And in the process, started what's now called the timeshare cancellation industry. Timeshare is the only thing that you can buy that you can't tell me how much it's going to cost or when it's going to end. When you buy a timeshare, you give them a blank check to fill out any amount they want for annual maintenance and assessment fees. The crazy thing is, this never ends. Even when you die, your family's now going to be stuck with this burden. Stop the insanity today. Call my office now. If we take you as a client, I guarantee we'll cancel your timeshare or you'll pay nothing.
Call for your free information kit. 800-462-3333. That's 800-462-3333. 800-462-3333.
Imagine getting ahead of your irritable bowel syndrome with constipation or IBS-C by treating it with Linzess. Then you could start proactively managing your constipation with belly pain and get ahead of your symptoms. Talk to your doctor about Linzess, linaclotide. Linzess is a prescription medicine that treats IBS-C in adults. It's not a laxative. It's a once-daily pill that helps you get ahead of your symptoms. It's proven to help you have more frequent and complete bowel movements and helps relieve overall abdominal symptoms, belly pain, discomfort, and bloating. These symptoms were studied in combination, not individually.
Do not give Linzess to children less than 2. It may harm them. Do not take Linzess if you have a bowel blockage. Get immediate help if you develop unusual or severe stomach pain, especially with bloody or black stools. The most common side effect is diarrhea, sometimes severe. If it's severe, stop taking Linzess and call your doctor right away. Other side effects include gas, stomach area pain, and swelling.
Imagine what could relief from IBS-C mean for you. Talk to your doctor and say yes to Linzess. Learn more at linzess.com or call 1-800-LINZESS.
The Angie's List you know and trust is now Angie, and we're so much more than just a list. We still connect you with top local pros and show you ratings and reviews, but now we also let you compare upfront prices on hundreds of projects and book a service instantly. We can even handle the rest of your project from start to finish. So remember, Angie's List is now Angie, and we're here to get your job done right. Get started at Angie.com. That's ANGI, or download the app today.
Talk 1480 WHBC. We are again going to wrap up our segment with Aultman and AultCare this morning by talking about the commitment to community. And as I said, we already know that here at the radio station. We see it firsthand all the time. And we welcome in this morning Vice President Foundation Services, Lisa Zellers. Hi, Lisa.
Hey, Pam. How are you today?
Doing great. And also Vice President Fund Development, Eric Belden. Hi, Eric.
Hello. How are you?
Doing well. So let's start off talking a little bit about Aultman and the commitment to community, because we see Aultman everywhere, right?
We do, and I love that you said that. Thank you. I love that you said that, Pam, and thanks for that question. First of all, to start with, Aultman is the first and only independent healthcare system in our community, focused on you, focused on the individuals. And that is really where our commitment to community begins, is with each and every individual. And Pam, whether someone is in need of care or wellness, education, or insurance, we can wrap our services around those individuals to meet their needs. And not only meet their needs in terms of, providing services, but also to do it with extraordinary care and with an extraordinary experience. So that's really what we're striving towards. So that's where it begins. But it doesn't end there. So we also support our community to further help and assist the individuals, families, our neighbors here. And again, to your point, that's exactly why you see Aultman everywhere. You see us in our schools. You see us partnering with our nonprofits in our community. You see us working with our business community, trying to foster and drive economic development. You see us working with our youth programs and senior programs. That is our commitment. And we do it in a number of different ways. It's not just financial resources. We've tightened our belt. All businesses, nonprofits and otherwise, are experiencing different times right now. And so our support is, while we're always, supporting financially, it's also manpower, resources, boots on the ground. We have individuals that are serving on board of directors, that are volunteering, giving back to our community, and we're really proud of that. And it's why you're seeing now a new marketing campaign that's going to be rolling out here, talking about, Aultman in your community, here for you in your community. So we're very proud of the commitment to the community. I like to say it's part of our culture. It's who we are. And I think it sets us apart as an organization. And I hope that the community sees that as well.
Yeah, the community absolutely does. And when you say Aultman, I mean, think about all the entities that people say. When they say Aultman, what do they mean with all of those entities? They mean so many different things, right?
Absolutely. It's, I've been here a few months, and it's confusing to me. I'm learning as I go here, too. But as a community member, I think the one thing I've learned just in the few months that I've been here is just, one, how humble Aultman is, but just really how, as Lisa explained, how we are everywhere and try to do everything that we can do as a system to support our community. Not just the Canton community, but Orville, Tusk, Carroll, Alliance, and several other communities beyond that. And it's been a blessing, to be here and kind of learn, who we are, what we are, where we're headed, and what we can do to continue to support the community as we further our mission.
So what's the difference between Aultman and AultCare when people are saying, they're saying Aultman almost for everything when they mention different things?
They do. So I like to describe the system in terms of the Aultman health system is truly the system of all of our services, Pam. So under the Aultman health system, you'll find Aultman College, educating our future healthcare workers. You'll find our healthcare delivery system, and you'll find AultCare, our insurance plan, and then also that's where the Aultman Foundation is also a part of that as well. So again, I think that's what sets us apart is the different components of the services that we're able to, again, wrap around each individual to better serve their needs.
Yeah, Eric, talk about the foundation, because that's a whole nother entity that does so much in the community and has such a far-reaching arm in the community.
Yeah, thank you. It's a piece that we're trying to grow currently right now. It's a piece that, as Lisa said, times are different. Years and years and years ago, when you look back at the 130 years when it started, they didn't have to fundraise. We didn't have to raise dollars to do what we did or what we're doing now every single day. And Aultman was lucky enough to have the Women's Board, which started over 50 years ago, which did, fundraising at a major level for the hospital, but not at the level that we need currently. And so the foundation, even though we started just a few years ago, we're evolving right now. And so how can we raise more dollars to help more people, to help the hospital do the things that we need to do throughout all the counties that we're actually working in? And that includes, fundraising that we need donors to help us with. It includes some third-party events that we do. And, everyone knows the angel auction, of course, and some of the events that we do that way. But we're doing some smaller fundraising events so people in the community can participate where they want to participate and how they want to participate. But really for us, it's raising dollars to continue the programming that we're doing and the services that we provide to the community. And of course, folks also know that we give back. So we also give through the foundation, we give grants back each year that organizations, nonprofits can apply to, and we're happy to continue that support annually. And we just actually sent our round of fundraising just took place. So, hopefully the community next year will keep their eye on the on our when we post, and they'll put their applications in and we continue to support the nonprofits that we can.
And you mentioned you've just been here a little bit of time, so talk about your new role here.
Yeah, blessed, for sure. The biggest thing for me was I've been a part of the community for a long time, since I came back from New York from college, and, what can I do to help? And, we were laughing earlier, my Hall of Fame days, Pathway Caring for Children, and then the last 11 years for me was at Walsh University, which was just an amazing opportunity to fundraise and support the community. And then, lo and behold, this, an opportunity comes about to be a part of Aultman. And one that I, never really thought. I would just serve on the board and do everything I can to support Lisa, the team, and my community. And to be asked to help, be a team member of the initiative to raise more dollars to do what we're doing was just amazing. I'm really, really looking forward to what we're going to be doing. So we have, there's lots to come that we're not going to quite be sharing today, but the need is great here for sure, and because the community needs us. And so that's how we're going to continue to do what we can do to support this community through fundraising initiatives. And so, like I said, I won't let the cat out of the bag, but we have some new initiatives kind of up and coming as we continue to try to increase the services that we provide to the community here.
That's exciting. We always like to hear that, and we'll end it on that exciting note. That's what we call a tease in the business.
Oh, okay, great.
Okay, all right. Sounds good. Well, we will talk again with you soon as you can let the cat out of the bag. How does that sound?
Would love that opportunity.
All right, very good. And we appreciate everyone from Aultman and AultCare and the foundation for coming on and talking with us today. And for the last hour, for this first hour today of our Health Week. And this next hour, the 11 o'clock hour, we're going to talk to the folks with Jackson Family Practice, Dr. Stan Anderson, and we will do that after the news on News Talk 1480 WHBC.
WHBC AM Kenton.